My name's Jen Marshall. I've been playing professional football in a women's league for 3 years. I've been an athlete my whole entire life. Today I manage a gym. I've been doing it since 2015. So every morning when I wake up for work, it's really not like I'm coming to work. I get to be with athletes, people trying to better their life every single day.
But in November 2018, a sudden pain slowed down her active lifestyle.
So most of my pain was located right in the central of my tailbone. I did have a lot of numbness and tingling going from my low back all the way to the top of my knee down the side. It was kind of a stabbing pain anytime I tried to bend over, pick anything up, even something as light as taking out the trash. It was like a catch. So it's like it took your breath away, kind of had to bend over for a few seconds, do this awkward squat to get it to go away until the nerve would kind of release and let me stand back up. So it felt like I was constantly being stabbed by a knife right in my tailbone. I was not sleeping very good at all. Flipping, I'd go from laying on my back to flipping over to my stomach, trying my sides, but with the tingling down my leg, that would act up even more when I was on my side, so there really wasn't anywhere comfortable. When I wake up in the morning, I was having to roll out of bed. Sometimes my husband was having to come pick me up to get me moving a little bit.
Not ready to consider surgical options, Jen tried conservative treatments to ease her pain.
I went to my chiropractor that morning that I couldn't stand up. We got MRIs done. We were trying decompression with my chiropractor. We tried, a little bit of massage. We tried a epidural. We did epidural in January, and still at that point, nothing was helping. Still had the stabbing going on. It was actually getting worse.
After 4 months of no relief, she contacted the Bonati Spine Institute for a permanent solution.
My mom has been working there since we originally moved to Florida. I was in middle school. She is a nurse in there, so she's seen every single day, everyone that comes in, everyone that goes out. We hear about all the patients, how they're doing, and the success. I've seen the success. I did already have MRIs done, so I got to bring those with me, so that kind of got me ahead of the game. He told me that I did have a herniation going on at my lower level of L5-S1. However, the numbness and tingling I had going down the side of my leg, he said was caused from a level above. So they had to go at my L4, L5 first. Dr. Bonati, all his staff, they go in great detail about, what you're looking at. I had no idea what, discs were and what herniations were and all that. And just by calling them over the phone, they explain all that to you and make you feel more comfortable.
The exclusive Bonati Spine Procedures utilize conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
I remember telling them that I felt great. They said I had a big smile on my face. But as far as during it, I don't remember a whole lot of it, to be honest with you.
Once a procedure is finished, guests are moved to the recovery room and a walking test is conducted. Afterwards, they are free to return to a hotel or their home if they live nearby.
Walked about 50 feet, turned around, came back, and I felt incredible. Got dressed, my sister walked me out to the car, and we went home. Sat on the couch, kind of took a little nap, but felt pretty good. Woke up, ice, and the main thing they told me was keep walking, keep walking, keep walking. After my first procedure, all the numbness in my leg was completely gone. I had no tingling, I had all feeling back. I could scratch the side of my leg and feel that I was scratching it.
After a Bonati Spine procedure, patients are not required to wear an uncomfortable brace or endure weeks of physical therapy. Instead, they are instructed to walk about 40 minutes a day.
He cleared me to start working out lightly, riding a bike, no more than 15 pounds, about 2 weeks after surgery. Pedaling the bike felt great, kept him updated, told him I felt really good, told him my weights felt really good. Work, everything was fine. I was able to start taking out trash lightly, still not going overboard because I knew that I still had, some work done that I had to give time. We're about 3.5 weeks out of my second surgery now, and I'm able to do pretty much anything, still to an extent with weight limits because he doesn't want me pushing it too much, but I'm able to do, assisted pull-ups now. I'm riding a bike. I'm walking continuously at an incline on treadmills. I can do push-ups again. I can, take trash out of the house. I can get out of bed, no problem. I'm happy to come in every morning. I want to keep doing more and more. My employees can tell that, I'm just excited to be back to the athlete I knew I was when I was in college and a couple years after college.
Jen highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
You're in great hands once you enter that place, and even after you leave, you always have a contact that you can reach out to if you have any other issues going on.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.